dashboard number 1036 as of the 22nd of March 2022, and then I'll move on to a summary of the status in the parallel healthcare system. So now referring to the COVID-19 dashboard as presented by the Ministry of Health, there were an additional 251 cases reported yesterday, taking the total number of active positive cases to 9,384. An additional 3 persons succumbed to COVID-19, and that takes the total number of deaths to date to 3,719. And we would like to extend our sincere condolences to the relatives, friends, and family members of the deceased. Our vaccination percentage uptake nationally is currently at 50.5%, so we've just crossed the halfway mark in terms of our population, and the Honourable Minister and CMO would have been providing updates on our vaccination drives. I'd like to now move on to an update on the status of the parallel healthcare system, and in this update I'm providing information on the hospitals in the parallel healthcare system, as well as a change with respect to our step-down facilities and also the accident and emergency departments. So I'll start with the hospitals in the parallel healthcare system, and we have noticed positive trends for the past 34 days. During this time, we have noted that the overall occupancy has been 40% and less, and this has been a consistent trend. This, of course, is a very welcoming sign and is a positive trend. At present, and as of this morning at 8 a.m., the national overall occupancy is at 22%. And to put this into context, 2 out of 10 beds are currently filled. Again, a very positive trend and a good sign, and hopefully part of our return to normalcy. When we look at the actual hospitals in the parallel healthcare system, all hospitals are under 30% occupancy levels. Again, this is a positive trend, and it's very promising because it means that only 3 out of 10 beds at each hospital in context are fully occupied. Broken down by level of care, ward level occupancy is at 22%. ICU occupancy, usually our cause for concern, is at 26%, with 21 of 80 beds in Trinidad and Tobago currently being occupied, and HDU occupancy is at 13%. If we were to look at the actual number of patients in the parallel healthcare system this morning, the trend of decreasing numbers continues. There are currently 175 patients in the parallel healthcare system, of which 159 are in hospital and 16 are in a step-down facility or considered at that step-down level of care. I'd like to now draw your attention to a change that we would be making in the media release effective today, the 23rd of March 2022. The Point Fortin Hospital was rededicated to the people of Point Fortin and has now been included in the traditional healthcare system. The area hospital Point Fortin has been upgraded to now treat moderately and severely ill patients. So patients in the area hospital Point Fortin are now being treated with oxygen and for more serious cases of COVID-19. Of course, the capacity to treat step-down level patients is available at all our hospitals. And so as of this afternoon, and according to our dashboard, the area hospital Point Fortin will now be classified under hospitals as opposed to step-down facilities. Yet again, this follows with the Honourable Prime Minister's announcement that we will be consolidating the parallel healthcare system as we attempt to return to normalcy. In our accident and emergency department this morning, there are 15 patients across 10 accident and emergency departments. We continue to notice over the last 2 months a decline in the total number of patients in our accident and emergency departments that are COVID positive. And also we have been seeing a significant lower number of ICU level patients. In fact, over the last 3 weeks, we have had 0 ICU level patients being admitted into the accident and emergency departments. The ambulance services, another indicator that we use, has a low overall usage for COVID-19 patients, and the 7-day rolling average, just as Dr. Hines would speak about cases for ambulance usage for COVID patients, is currently at 15%. To put this information into context, these occupancy levels, accident and emergency levels, numbers, as well as ambulance usage percentages, occurred last year in early April, and that was pre-spike. We would have noted that a spike was noted from on or about mid-April and generally progressed onto July, and then again from October we saw again yet another wave. But the current occupancy levels and the number of patients in our hospitals really are reflective of a trend of less severely and critically ill patients requiring care. Ladies and gentlemen, as I close this morning, I would like to reiterate the importance of seeking medical care early and complying with the Ministry of Health approved levels of care. Please give yourselves and your relatives a chance by seeking medical attention early if they have signs of COVID-19 or they are confirmed with COVID-19. This virus continues to have a level of uncertainty, and we must be prepared. However, let us continue to practice the following certainties. Vaccination. Vaccination has been proven to reduce the impact of the COVID-19 virus, to decrease transmission to persons who are vulnerable. Vaccination has been proven to reduce the risk of hospitalization, especially given the levels of ICU and HDU care that may be required. The 3 W's are WHO guidelines that have stood the test of time. Let us continue to wear our masks properly. Let us continue to wash our hands and sanitize our spaces accordingly. And let us continue to watch our distance. On behalf of my team and all frontline medical colleagues that have worked selflessly and tirelessly over the past 2 years, we would like to thank you for your continued cooperation and for the opportunity to present this information. Thank you very much, and I hand over to Candice.
Thank you very much, Dr. Richards, for that quite positive information, but also the reminder. And I know that we all will ensure that we continue to follow the personal protective measures that have helped to get us to this point. And we have Dr. Hines here with us, and as you expect, once Dr. Hines is here, we get an epidemiological update. Let's go to him now, please.
Thank you, Ms. Alcantara. Good morning to my colleagues, Dr. Abdul Richards and Dr. Othello. Good morning to members of the media, members of the viewing and listening public. If we can go straight into my first slide, we will dive directly into the epidemic curve for the period up to March 22nd, 2022, And what we see is, as we've been noting, the colored sections of this curve are the representations of daily numbers of cases in given months, each color representing a different month, starting from the month of January 2021. The gray bars are 2020 over to the left. 2021 begins the colors. The very tall bars on the right-hand side were the months of November, December, January, February, and we see as we move towards the right, the light green and the blue are January and February 2022, with progressively shorter bars, meaning progressively smaller numbers of cases being diagnosed on a given day. The orange or brown, depending on how they look on your screen, bars to the extreme right are now the numbers of cases that we're seeing in the month of March 2022. And we do see that there is a significant drop-off or decrease in those numbers of daily confirmed cases. At present, what we have is a 7-day rolling average of about 312 cases on a given day over the last 7 days or so. If we move to the next slide, we look at the same data now, but aggregated at a weekly time scale. So this next slide gives us the same information, but now looking at the numbers of cases that have been accrued within given epidemiologic weeks. We haven't changed the slide yet, but if we do get to that slide, what you will see is the same colors now representing months of January, February over to the right, light green and blue, and then the orange or brown on the extreme right, again showing the numbers for the month of March. And what we notice is that from the last completed epidemiologic week, or the difference between the previous and the last, week 10 and week 11, has been about a 20.9% decrease. Against that, we also look at the background section, that salmon section, which is showing a decrease in the overall levels of positivity, meaning the percentage of people presenting for care who were tested for COVID-19 and come back positive, and we're seeing that drop into the low 30s in terms of percentage positivity. So that again is an encouraging sign. We will skip to the next, which is basically the same information. Next slide, same information, but on in a tabular format. So we'll skip past that and go to the next slide, which shows the information now on a monthly timescale. And again, we can see the same basic trend of decreasing heights of bars. January, light green; February, blue; March, that orange color. And if we look at that, the totals for those months, we're looking at an average over the month of January of about 633 cases a day, dropping to 579 in February, and currently around 355 if you look at the total monthly average, 355 cases a day. So that downward trend, again, manifesting itself on that monthly time scale and giving us some encouragement that the levels of illness presenting to the healthcare system have indeed begun to go down. Moving to the next slide, which is the demographics, we're looking again at that, what we call a demographic pyramid, number of cases by both gender and age group. And we see that that has maintained basically the same shape throughout the pandemic. And that has shown us that we've gotten approximately 50-50 in terms of percentage, male and female, and about half of the cases have been in that 25 to 49 year age group, compared with the next slide, which shows the same demographic distribution but for the fatalities. And with that next slide, we see that among the individuals who have died from COVID-19, the age distribution is different. There is a predominance among the older age groups and a slight predominance among the males, about 57% compared to 43, or approximately. Now, the other things that are important where the fatalities are concerned were the fact that many of these individuals would have had what we spoke about as comorbidities, other pre-existing chronic illnesses which predispose them to adverse outcomes. And as time wore on and we had the vaccination program in place, we noted that individuals who were not vaccinated were at much higher risk of having adverse outcomes and fatal outcomes. So we do want to continue, as Dr. Richards would have done, to encourage individuals to make use of the vaccines and also to adhere to the ongoing requirements for certain public health regulations, including the wearing of your mask, the washing of your hands, and the watching of your distance, not crowding spaces, etc., as we work our way towards a more stable and hopefully less disease-ridden population at this point in time. So with that, I will turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. As we all know, during the COVID-19 response the past 2 years and recently, mental health has really come to the fore as an area of focus in health. And so today we have with us Dr. Othello, who will give us some information about the resources that are available for mental health support. We go to Dr. Othello.
Thank you, Ms. Alcantara. Good morning. Also a wonderful morning to Drs. Hines and Richards. Good morning to the listening public across Trinidad and Tobago and to the members of the press present. Today I would like to share a little bit with you about mental health, but specifically focusing a bit on the issue of suicide prevention. During my first few slides, I'll go very quickly through some statistics, and then I will spend a little more time in the last few slides explaining to you what resources are available and how we can do our part to prevent suicides. In Trinidad and Tobago, the current the most recent World Health Organization statistics, and that's the 2019 suicide rates, tell us that we have a national average of 8.3 suicides per 100,000 population, and that 2019 figure compared very well with the global average of 9 per 100,000 and the regional average for Latin America and the Caribbean of 9 per 100,000. So we were below the national average in 2019. I've provided you with some statistics from the Trinidad and Tobago Police Service for 2019 and then showing you 2020 and 2021. And as you can see, whereas TTPS noted 92 suicide deaths in 2019, they noted 104 in 2020 and they recorded 128 in 2021. Can I have the next slide, please? As this slide illustrates, completed suicides are more common among men than among women. So you see men in green representing more than 75%, whereas women depicted in blue represent just about 20% of completed suicides. Next slide, please. This one shows the age distribution, and as you can see, suicide can happen across what we call the life course. In other words, at any point in a person's life, there can be the risk for suicide. However, it's more common in adolescents, younger adults, and adults in the working age group. Next slide, please. Okay, so this slide focuses on what is suicidal behavior, because different people sometimes mean different things and use the same word. So I like to clarify things. And in mental health, we look at the whole spectrum of suicidal behavior, which includes what we call suicidal ideation, or thoughts about harming oneself or ending one's life. Then there are non-suicidal self-harm events. In other words, somebody harms themselves, but their intent at that precise point in time is not to die. And then we have actual attempted suicides, where the harming of oneself is for the purpose of ending one's life. And of course, not showing in that diagram are the completed suicides. Why do I show this slide? So that we understand that suicide is a complex issue. The whole issue of suicide and self-harm is quite complex, and it's not just one behavior or one type of incident that we're talking about. And we have to be concerned about that entire spectrum and do what we can to reduce the prevalence of all of those events. Can I have the next slide, please? So now that we're talking about reducing the prevalence, we have to talk about risk versus resilience. In other words, when I talk about resilience, I can point you to that diagram of the little girl kicking the toy. Some of us would remember that toy when we were small, where every time you kicked it, it would bounce back up, and you punch it and it would come back up. It never stayed down. It was designed to always come back up and stand upright. And that is a way of depicting the issue of resilience. In other words, resilience is a person's ability to bounce back from adversity. We all face adversity. We all face difficult circumstances, and sometimes some people face more tragic circumstances than others, or greater challenges than they feel they're able to cope with. And that takes us to the first drawing, which shows you a seesaw with somebody on it. And as you would see, on the high side, there's the word risk factors, and on the low side, there's protective factors. And not just for suicide, but for most areas of mental health, remaining well and remaining safe is a function of how well we balance those two types of factors in our lives. In other words, there are risk factors such as extreme stress, substance abuse, some types of mental illness, family breakup, family disruption, severe types of trauma. All of those are risk factors. But then we have protective factors such as a caring, supportive family background or community level support. Coping skills is a very important thing. As we build our coping skills, that side of the seesaw starts to go up. Living in a state and functioning in a stable environment, and of course positive experiences in our lives. I always tell people we can't control what comes at us, but what we can control is how we respond to it. So it's very important for us to take care of ourselves and for us to build our coping skills so as we have that arsenal of tools to use when we are faced with difficult circumstances and we are able to bounce back. Can I have the next slide, please? So this slide illustrates what is happening in Trinidad and Tobago with regard to suicide prevention. And this is just a summary, really, because there's a lot going on. Sometimes we're not aware of everything that's happening because a lot of it is happening behind the scenes, but there's a lot going on. Since as far back as 1978, Trinidad and Tobago had a suicide support helpline, and it's called Lifeline, and it is still up and running today. In addition, the mental health services that are provided by the regional health authorities in all communities or most communities, at those facilities there are people who are trained in mental health who can support persons who are thinking about suicide or who are going through overwhelming or difficult circumstances. There are psychiatrists, psychologists, social workers, art therapists, music therapists, occupational therapists. We have it all across the spectrum within the hospital setting and in the community clinics. So that once you present to one of those services, you can be afforded whatever type of therapy would be best suited to assist you. In addition, a lot of training goes on, and the Ministry of Health has begun rolling out a training package called MH Gap or Mental Health Gap, which aims to fill the gap between the need and the service that is provided. And we do that by training the people who you go to first, the people who see you first when you access healthcare. In other words, the general practitioners in the community clinics, the doctors in accident and emergency rooms, and other healthcare workers across that spectrum. So we intend to continue that training. In fact, we intend to amplify the amount of training that we're doing in that regard. And that mental health gap curriculum has a specific suicide prevention component built into it. Then we have a lot of advocacy going on across Trinidad and Tobago. There are lots of persons with lived experience who have either experienced suicidal thoughts or may have at some point in their life made an attempt, or who may have had a family member who ended their life by suicide. And a lot of those persons now engage in advocacy, doing mental health promotion, sharing their stories, encouraging others, teaching others how to listen in a non-judgmental way and how to support each other. And a lot more mental health promotion. Apart from the advocates, we have the Ministry of Health doing some mental health promotion, and we have some social media posts that go out from time to time that share information about suicide prevention. The regional health authorities have outreach groups that also do a lot of mental health promotion, and there are a number of non-governmental organizations and community-based organizations, as well as individual service providers, individual mental health experts, who have come to the fore, especially since this pandemic started, and are sharing information with the public in their own efforts to help reduce the prevalence of suicide. We also have some support groups that support survivors of suicide. And of course, I couldn't talk about this topic without once again redirecting you to the Ministry of Health's website, where you go to the mental health link, and there you can find findcareTT.com, which is our digital directory of emergency mental health services, the services that are required to support someone in a crisis. It's findcareTT.com. And if you don't remember it, you just go to the Ministry of Health website, go to mental health, and you would find it, and you can look up for the resources that you need. And we also have a print copy of that available, and we are in the process of distributing them as widely as we can. At the Ministry of Health, we are also engaged in some more focused activity in terms of suicide prevention. And we have completed just recently a national suicide prevention strategy, and we're in the process of working out the details of the implementation plan for that strategy. So that is something that will be happening in the very near future. And we are also at the ministry in the process of implementing a national suicide and self-harm surveillance system, so that we can know in real time what our statistics look like, and we could break down those statistics by age and gender and things like that, so we know where to put resources in order to assist persons and provide the promotional as well as the therapeutic services that are required. For persons who want to join in this effort, please feel free to do so. Everyone can assist. Nobody is, unable to help. Everyone can support someone. And if you want to do more than that, there are resources available where you can receive some training. At the Pan American Health Organization, that's PAHO, at the PAHO website, they have a virtual campus, and one of the programs offered there is called Psychological First Aid, or PFA. You know how many persons learn first aid, what to do with a cut, what to do with a burn, that sort of thing. There is something called Psychological First Aid, which teaches you how to support someone who is going through a difficult situation or a crisis. There is also, as I mentioned before, the MH-GAP training that is available for primary healthcare workers. And PAHO also has at that virtual campus a course called Preventing Suicide and Self-Harm, which is aimed at primary healthcare providers. That's general practitioners, accident and emergency workers, and other healthcare workers who work at the primary care level. And I want to emphasize that these courses are not just for Ministry of Health staff or RHA staff. Any general practitioner out there working in the community, seeing your patients, who wants to know more about how they can support a patient who might potentially be suicidal or might be depressed, please go to the PAHO virtual campus, and you will find these courses, and they are free of charge. So, last slide, please. Well, the last slide simply said suicide prevention is everyone's business. So thank you for listening, and I hope that everyone would do his or her part to help reduce the prevalence of suicide in Trinidad and Tobago.
Thank you very much, Dr. Othello, for joining us on the COVID-19 conference. Again, very important information and lots of resources there for all of us. Everyone has a part to play in mental health. And we go into the question and answer segment. At this time, we ask members of the media, please state your name and the name of the media house that you represent before you pose your 2 questions. We ask you to keep your questions brief and pose both at the same time. And if we have additional time, we will come around to those who have additional questions so that we can try to answer those as well. Let's start off today with AZP News, please.
Hi, good morning. Suan Wire from ACPnews.com. Last night, the Prime Minister hinted at the possible reopening of all sectors completely, and he said that there was no reason why they should not be open. How does the health team feel about this announcement, and what recommendations, if any, are already being put in place for moving forward? Thank you.
Okay, so thanks for that. As you would have noted, the Prime Minister indicated that he will be meeting with the health team future tense. So until that meeting happens, any comments would be preemptive and premature. So we're going to await that meeting before any further announcements or discussions on the way forward there would be made.
Thank you very much, Dr. Hines. Let's go to Guardian Media Limited, please.
Hi, good morning. Kevin Feldman, Guardian Media. Dr. Hines, based on what the Prime Minister said, I know you said that you have to meet with him, but a few weeks ago, we already had some removal of some of the restrictions. So earlier on in the pandemic, the Ministry of Health said it was following WHO guidelines. Just a few weeks ago, PAHO, a sub-agent of the WHO, advised countries against reducing public health measures too early. So is it that we've moved away from the international recommendations or just adjusted based on our own circumstances? And even, looking forward to that meeting with the Prime Minister or the Minister of Health, what are some of the cautionary measures or restrictions that you think should remain in place, even if we have to reopen further?
Thank you. Dr. Hines?
Okay, so thank you for the first part of the question. I think you answered the first part of the question yourself. As the WHO and the PAHO would have recommended, you don't want to remove precautionary measures too early. Too early means that you have assessed the risks, you have assessed the functioning of your healthcare system, you've assessed your numbers, and you make decisions based on the data that's available to you. So you wouldn't make a policy change without having made those assessments. That's what too early means. So we continue to make assessments and to make recommendations in accordance with the data that those assessments would contain. And as we said, since the Prime Minister has not yet spoken to us, we're going to leave the discussions on what could or could not come out of that discussion until after we have actually spoken with him. Thank you.
Thank you, Dr. Hines. Newsday, we're ready for your questions at this time, please.
Good morning, Paula Linder here from the Newsday. So I have two questions. The first one is, will the ministry be allowing Easter activities such as crab racing in Tobago, kite flying in the Queen's Park Savannah, sports days, etc.? And are those events only for safe zone areas? And the second one, Dr. Richards, I noticed on the last few health updates that only one of the step-down facilities is being occupied. Are there any plans anytime soon to decommission any of those? Thank you.
Dr. Hines, you want to take the first question?
Okay, I'll take the first question. Again, what remains open or doesn't remain open, what changes will be taking place after the meeting with the Prime Minister, those changes will be announced in the wake of the meeting. It would again be preemptive to make any statements on what will be happening beyond this point until we've actually spoken with the Prime Minister.
Thank you. And Dr. Richards, the second question.
Good morning. Thank you very much, Ms. Lindu. Yes, the step-down facilities, and I'm referring to the UTT step-down facility, the Davis step-down facility, the Takrigwa Racket Center, are all empty and have been empty for approximately 1 to 2 weeks because there are no patients in those areas that require step-down care. The current facility that is being classed as a step-down is the area hospital Point Fortin, but as I would have indicated in my update, this hospital has been upgraded to really cover and to provide measures that the Point Fortin Hospital would have covered. At this point in time, the Ministry of Health continues to review the occupancy and the requirements for care with respect to step-down level patients, and the Honourable Minister will provide information as per a policy update on the actual decommissioning of the relevant facilities. Thank you.
Thank you very much. AZP News, I believe that we have a follow-up question from you today.
Hi, yes. With respect to the first questions that I asked, I didn't get part of it answered, which is how do you all feel about such announcement being made after this time? And the additional question that I want to ask is there's a protocol in place concerning a COVID test being done on persons who have died. With respect to bodies who have been found, some in a state of decomposition, can you please explain the science behind that protocol and if it's something that will be kept, because families of those persons are saying, it's an inconvenience to them. Thank you very much.
Dr. Richards, Dr. Hines?
Okay,
sorry.
I'll take I think the second part first. With respect to bodies being found, I believe that the protocol at this time is still that a COVID test needs to be done, because that guides how the following procedures will be carried out. Whether the person is COVID positive or negative then determines how the next steps are taken. So at this point in time, until a policy decision is made to reverse or to alter that remains in place. And I think we did answer the everything that had to do with the Prime Minister's announcement a few times.
Thank you very much, Guardian Media Limited. Let's hear from you again, please.
Good morning again. There have been international news reports about Delta Cron, a supposedly new COVID-19 variant. Have we detected any of that here in Trinidad and Tobago, and are you all concerned about it?
We go to Dr. Hines for that one again.
Okay, thank you for that. Yes, we have seen the international reports. We have not detected any cases in our sequencing thus far. Of course, anything that is in circulation, anything that can have a different public health impact from what is currently in circulation would be of concern to us. So we do continue to monitor, not just for that particular variant, but for the emergence of any other variants that have a more severe public health impact. And we will continue to keep the public apprised as any of that information becomes available.
Thank you, Dr. Hines. And before we go to AZP News, just a reminder to members of the media, Dr. Othello is also here with us, and you have a wonderful opportunity to pose questions to this very experienced subject matter expert. Let's go to AZP News, as I said, for another question, please.
Hi. Recently, there have been reports, again internationally, of bird flu. And in the UK, authorities have recently stopped the sale of free-range eggs in order to contain it. Is this something that we should be concerned about here? And if so, what measures are in place for it? Thank you.
Okay, thanks for that. That's an interesting and important question. It speaks to the wider sort of public health surveillance that happens not just for COVID, but for a range of pathogens that could have some sort of impact either on human health, on agriculture, etc. At this point in time, that particular concern doesn't affect us directly, but we do continue to monitor, we do continue to look at what's happening both with the WHO and with the other agencies that monitor animal health alongside human health. So we do continue to keep an eye on that, but at this point in time, it doesn't have a direct impact on us.
Thank you. I see that Newsday has a follow-up question. Let's go to Ms. Lindo, please.
Good morning again. My question is actually for Dr. Othello. Yesterday in the Senate, Minister Dayal Singh would have said that when he was speaking to you, he was surprised to learn that some people who are contemplating death by suicide are not actually depressed and sad. Could you give us an indication of some of the things that people can look out for in their loved ones? Thank you.
Certainly, that's an excellent question. With regard to that comment, The minister was referring to an explanation that I gave, whereby sometimes people may be depressed, but at the point where they make the decision to end their life, they feel a sense of relief, and then their appearance is no longer as sad, and people mistake that for thinking that the person is better. So that's something we have to look out for. Other ways of monitoring increased suicide risk in a person have to do with the things that they say, the things that they do, and observations of their mood. With respect to what they say, people may be talking about ending their lives. They may say things, they may say it indirectly, so they may say things like, I'm no use around here, or maybe this family would be better off without me. So that if you hear those kinds of comments, it's a red flag, so to speak. They may say things that express a measure of hopelessness, or feel that they are a burden to others. In addition, the way they interact, the way they behave, they may start to use more alcohol or other substances excessively or dangerously. They may become agitated or increasingly irritable, or they may withdraw socially and just have nothing to do with the people they normally interact with and socialize with. They may be sleeping all the time, just hide out in their room and just avoid everything. And very significant, sometimes they start to give away stuff, and that is often a flag, right? They may write a note, or they may start to give away stuff. And then with regard to their mood, they may look sad, or they may suddenly transition, as I said before, from looking sad to suddenly looking very, very happy. They may lose interest in the things they normally enjoy doing or participating in. And, they may be agitated or easily angered and things like that. All of these are individual attitudes or behaviors that you may observe. No one by itself says that a person is suicidal. But I listed a whole range of them to make the point that when you see something that might be a red flag, please encourage that person to talk to someone, to be evaluated by someone who knows how to evaluate that risk and who knows how to provide the care that that person needs if the risk is in fact escalating.
Thank you very much, Dr. Othello. Very important points and easy to understand, and something that we can act on, especially if we see any of these signs among our loved ones. We have a follow-up question from Guardian Media Limited at this time.
Hi, Dr. Othello. That last part is based on what I wanted to ask you. A lot of science people are going through problems, and you suggest counseling, you suggest speaking to someone, but they're quite reluctant. Sometimes they think anytime you see therapist, they think I am not crazy, or I don't need that type of help. I mean, how do you get or persuade someone that here's what you have a circumstances that needs professional help? And how do you get them to just move beyond feeling sad and actually reaching out or going to get the help?
Thank you for that very important question. It starts with just listening. In other words, the first step is not let's get you to the psychiatrist or to the mental health clinic. The first step is, how are you doing today? Tell me what's going on. I just want to listen. And just, listen in a non-judgmental way. In other words, we like to give people advice. Sometimes we just have to shut that off. We like to tell people things like, I know how you're feeling and I know what you're going through. Forget all of that. Just listen and give that person a chance to unburden themselves. And when they've done that in a manner that assures them that you are caring, that you are compassionate, that you are going to be kind towards them, then you say something like, I know this must be difficult for you, and I would like to be able to help you. Would you allow me to assist you in getting some help? And at that point, you start to share with them ways that they can get that help. And if they're concerned about being deemed crazy, you just explain to them what I always explain to people, that the brain is an organ of the body just like any other organ of the body. The heart can get sick, the liver can get sick, the kidneys can get sick, the brain can get sick, right? And, sometimes the brain just has too much to deal with at a particular point in time, and it needs some assistance. That assistance can come in the form of therapy of various kinds, but the most important thing is to listen, to let that person know by experience that you care, and then to introduce gently the subject of, so what can we do? What do we do next? Where do we go next? Right? Sometimes we have to say things like, I care about you too much to leave you feeling this way. I want to help you. I want to make sure that you get the care that you need. And people often respond to those approaches.
Thank you very much, Dr. Othello. And I don't think that we have any more questions from the media at this time. And so we have come to the end. Thank you for joining us very much for this COVID-19 conference from the Ministry of Health. Just a reminder that findcareTT.com or Ministry of Health's website at health.gov.tt are two online resources that you can look into for information, for support, for mental health support. And I know that we've been on a long journey, everyone, but please let us encourage each other along this journey, along this road to being safe. Everyone have a good day. Trinidad and Tobago, please, if you haven't already, get vaccinated and get boosted. Have a good day.
I must compliment North Central for one, having this here where it's accessible for those of us who live around, so that's one. And the process was really fun. We had music to keep us entertained. The service was great from the start, where the attendants or whoever there with your forms, any questions, telling you exactly where to go, so you were not wondering where do I go next. Excellent. Right, so hats off to you all, continue the good work, and we just hope more people get vaccinated. Vaccinate, vaccinate, vaccinate.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Came at the UTT campus, Shogunas Monroe Road, where is one of the mass vaccine sites. Came in, was greeted by the staff. There was wonderful from by the gate, community staff members, the security officers, filled out the documents, whatever was needed, whatever question was asked. The experience was wonderful. Came upstairs, followed the instructions, accordingly came to the nurses and them who were pleasant, and also took the vaccine. The reason I got vaccinated due to the fact I have loved ones at home to protect. And travel in public as well, as well. I love to travel and socialize with people. That's about it this week.
Don't delay. Get vaccinated today. A message from the Ministry of Health.